Hey, this is Dr. Ty from Premier Orthodontics, and in this video today we're going to be answering some of your questions from our YouTube channel. So as a reminder, if you haven't yet, make sure to subscribe to the channel, like the video if you find it helpful. Let's go ahead and get started. So first question, I'm not sure what's wrong with my teeth. My teeth don't close properly on the right side of my mouth. Top teeth don't align correctly to the bottom teeth. Can you explain to me how to fix it? So this could be a number of things. So it sounds like you're probably either describing a crossbite or possibly a lateral open bite. So if your top teeth don't close properly, it may be your top teeth sit inside of the bottom ones. That would be a crossbite. If they don't touch at all, that would be more of an open bite. So both of these conditions can be fixed with braces or Invisalign. Depending on what the type of condition is, it may require an expander for a crossbite, it may require rubber bands for an open bite, or a combination of those things. Without more specific images, it's hard to diagnose exactly, but the good news is whatever that problem is, most likely orthodontic treatment can get it fixed. And for more information on that specifically, definitely see an orthodontist for a consultation. They'll be able to give you more information. All right, next question. I'm 20 with slight overjet. Do I need extractions of premolars for braces? So some of this is dependent on the amount of crowding and the amount of protrusion of the top teeth. And if we feel like taking out premolars and retracting those front teeth would benefit, the aesthetics of your teeth and your profile. So if it's really just a slight overjet and everything else looks good, there's not a significant amount of crowding, most likely that can be fixed without extractions. But if there is a lot of crowding, if we feel like the top teeth really stick out and would benefit from being uprighted, or if the overbite is more severe than you may realize, those are times that extractions may be needed. So again, extractions, there's lots of factors that go into it. Biggest one for me is, after we get everything straight, are we gonna like the way it looks? If that answer is no, then extractions may be the best option. So hopefully that's helpful. Again, a consultation with your orthodontist is the best way to determine the specific plan for you, but based on the information provided, I would say most likely extractions are not needed, but it's hard to say for certain. All right, next question. This one is from Pedro. I have a question. I have an open bite and I've been wearing braces for almost 4 years. They've made me wear a box with elastics, and there was one point where my top teeth and bottom teeth touched. Let's say like 2 or 3 days go by without wearing my elastics. My teeth will go back up and the bite is open again. I don't know what to do. It feels hopeless. So the thing to remember with teeth is that if you start pushing on a tooth, it will move, but the minute you stop applying force and stop pushing on that tooth, it starts to move back. So if you wear your rubber bands really well for 5 days, but then you take 2 days off, those 5 days pull the teeth together, and then when you stop wearing rubber bands, they start to move back. So really you need to be really consistent. Open bites are really hard to fix. So most of the time an open bite is caused it can be caused by a tongue thrusting habit. So if your tongue is constantly putting pressure against the teeth, it can start to open the bite. So you're trying to use those rubber bands to counteract that force to pull those teeth together. And hopefully in time your tongue will get retrained to not go into that area. But if you take many days off with those rubber bands, the force of pulling those teeth together goes away, your tongue starts pushing the teeth apart again, and you see that open bite open up. So really, if you've been in treatment for 4 years, I would just make a commitment. You're gonna be 100% perfect with the rubber bands, wear them day and night all the time, take them out only to eat and brush. Do that for 2 to 3 months, and most likely you're probably gonna get your teeth together, and then you can get retainers to hold them in that position long term, and they will stabilize. So again, it's not hopeless. You just need to be really compliant with those rubber bands, and you should be able to get your bite fixed and hopefully get finished with your treatment. All right, next question. Do extracting teeth make your chin smaller? My chin is so big. So the bones of your face are not affected dramatically by the teeth. So with our mouths, we have the jawbone, and then the teeth sit within that jawbone. So something like your chin is not really connected to your teeth. And so if you want to change the bones of your face, that is where more of a surgical procedure is needed. So if you want to make your chin smaller, there are a couple different surgical procedures. One is where they move the entire lower jaw back. Another one is where they do what's called a genioplasty, where they just move the small amount of chin button back. So depending on how your teeth look, how the bite is, one of those options may be a good option for you, but extracting just your teeth will not generally make your chin smaller. So if you have an underbite and teeth or extractions are needed to help to fix the bite, that can move the teeth. But generally, I would not expect much, if any, really bone movement or chin movement through just extractions of teeth alone. That is where more of a surgical procedure is needed. All right, next question. Doctor, I'm trying to correct an overjet with elastics. However, on the mandibular jaw, I have some missing teeth. So those molars we are using to pull the maxillary jaw are shaking. How do I go over the shaking and how to prevent it? So the shaking you're talking about is basic mobility. So whenever we move a tooth, in order for that tooth to move through the bone, there is a ligament that kind of surrounds a tooth root. It's called the periodontal ligament. And when a tooth starts to move, that ligament gets enlarged, and that allows that tooth to move through the jawbone. That's part of the process. So whenever you get that enlarged ligament around the tooth, you will get some mobility. And if you're spending a lot of time moving teeth with a lot of force, you will start to see quite a bit of mobility in those teeth. And that, unfortunately, is just kind of normal. It happens, and it always happens with all your teeth. A lot of times, if your teeth are all connected with the braces, you don't really notice mobility because they're all tied together. But if you're at the orthodontic office and they take the wire out, you can try to wiggle your teeth. You'll notice that all of them are mobile. So that is normal. It is a little disconcerting when you see it. Those who are Invisalign patients may notice it even more because you take your Invisalign trays out, nothing is connected, and you'll notice that a lot of your teeth are moving. So that's normal. I would ask your doctor just to be sure that it's fine. If your teeth have a lot of bone loss or other periodontal issues, excessive mobility is not a good thing. But if that mobility is within normal limits, that's really not a problem. So hopefully that helps. And again, ask your doctor for further clarification. All right, so that was our last question for this video. So again, if you found it helpful, make sure to give the video a like, subscribe if you haven't yet, tap the bell for notifications. And if you have questions for us, make sure to ask them in the comment section below, and they may appear in a future video. Thank you so much for watching, and we'll talk to you soon.